It's now absolutely our pleasure to welcome Andy Burnham, who, if anything, needs even less introduction than Jeremy Hunt did, because Andy, of course, was Health Secretary for the final 11 months of Labour's long period in power, and he's now been Labour's health spokesman in opposition for almost 2.5 years. He's made it clear that if Labour win the next election, he will repeal Andrew Lansley's mighty 2012 Health and Social Care Act, though we might explore in questions a little more precisely what that means. And he's just received the report of the Oldham Commission, which Labour created, on how to get to the much better integrated or coordinated or whole person care that we spent part of the morning talking about. So there'll be loads to talk about. Andy, do come and...
Thank you very much, Nick. Good afternoon, everybody. I'm tempted to begin by asking whether you enjoyed my warm-up act, my warm-up man. I don't know, bit provocative to start that way, isn't it, I guess? So, less helpfully, I gather I have been billed today by an earlier speaker as one of the foremost purveyors of glutinous sentimentality about the NHS. It's a very big billing indeed. I hope I don't disappoint in what I'm about to say. I'll do my best. But actually, to be honest, it's the opposite that I've been doing these 4 or so years of opposition. I've been taking a very unsentimental look at things, and that's what I want to talk to you about today. Because I have to. I mean, opposition if it has a purpose, it's often a thankless job at times. It feels like that. Obviously, there's the job of attacking and holding to account the current incumbents. But if it has a constitutional purpose, a deeper one, then it is that pause for deep reflection on policy, to really take a hard, critical look at the way things are, and to examine and challenge thinking on every level. And that is what I've been doing in opposition. It's helped by the fact that I am a shadow of my former self, as Nick was saying. So I have that knowledge of having worked in the department. So that does give you a absolutely crucial perspective on things. And really, I mean, I've looked in detail at 3 things, or thought carefully about 3 things. Our own policy record as a government and what we achieved, of which I remain intensely proud. I will continue to remind people that we left an NHS with the lowest ever waiting lists, the highest ever public satisfaction. That wasn't achieved by Labour politicians alone. That was achieved by the collective efforts of many people in this room and beyond. It turned round the fortunes of the NHS, I think, as the Secretary of State was kind enough to acknowledge. And it was a period of renewal for the NHS. But we didn't get everything right. Of course we didn't. And I've been thinking deeply about that. Of course, I have to look at the current policy, the current path on which the NHS is placed, and I have a number of concerns about that. And that has to come into my thinking in terms of what I do next. And then the third area I've got to look at is the future, this century that we're in, the questions it is asking of not just our health system, but our health and care system. And I think it's asking questions that system is increasingly struggling to answer to the public's satisfaction. And that really is the kind of crux of the challenge before us. So when I've kind of taken this stand back and I've looked at the system, you might ask, well, what did I see? What do I kind of find when I take this unsympathetic look at the system? What I see is a 20th century model of care that is struggling and actually is on the point that it's in danger of being overwhelmed. I see a medical model of care predominantly that isn't actually equipped, geared up to aspire to provide to the people of this country a state of complete physical, mental and social well-being. I don't think it is geared up to do that. I see a system that doesn't work in partnership enough with the other services that determine health, housing, employment, education. too much in its own silo, but also highly fragmented within. Fragmented between primary and secondary care, physical and mental care, certainly council and NHS, but even so, even within the health service, very specialist, too specialist you might even say, highly focused on body parts, specialisms, and really doesn't, in my view, put sufficient premium on what good generalist care is. Hasn't done that enough. So that's what I see. But if you then bring it down to people, what does it mean for people? I see a service and a system that isn't delivering what people and families are looking for. What is the end result of that fragmentation that I described a moment ago? The result of that, to the average person in my constituency, is telling the same story to everybody who comes through the door. All of those different disconnected encounters with professionals of different kinds, the battle they face to coordinate care between the council, between the NHS. For the public, that just doesn't make sense to say to them, oh, the council deals with this bit of your mum over here and the NHS does that bit over there. It doesn't make sense, and it leads to real frustration. And a service that actually doesn't really provide for all of one person's needs is highly fragmented. And is the question then, of course, we have to ask is that sustainable? And I don't believe it is. If I look then at current policy, if I then say, well, these are the fundamentals that have been there in the system for many, many years. The change in demographics has brought out the cracks in the system. The cracks have become more visible as we've all got older. But I think current policy is really now driving the NHS towards the cliff edge. It's on an unsustainable path, in my view, and it really is heading quite quickly towards a serious collapse. Why? I think if you look at the disparity between health and social care, health so-called protected, debate to be had about that, but local government and social care certainly not. So we see the analysis from Age Concern in the news today that over the last decade, 800,000 people have lost basic support in the home. The help with daily living, getting up and about, getting washed, getting dressed, getting fed, basic preventative support in that social space. And that is the NHS's problem. The NHS can't say, oh, that's councils, we don't. We're seeing now the consequences of that in a change, in my view, in A&E, where we're seeing that sustained year-round pressure in A&E, building. That's because hospitals are increasingly full. I think the current path that we're on is in effect a plan for the hospitalisation of ever greater numbers of older people. That is what is happening. As simple support is taken away in the home, as a society, we seem to be happy to spend thousands of pounds keeping an ever-increasing number of older people in acute hospitals, often the worst place for them to be, where they may have their immediate physical needs looked after, but their social and mental needs are often neglected, and hence older people can often drop like a stone in that acute hospital environment. That's as I see it at the moment. This is the path that the current system is on, and I believe it will hit the buffers in a serious way quite soon if we don't wake up to what is happening. I don't see a system that is going to provide the standards of care that you would want for your parents, and I certainly want for mine. Indeed, we should aspire as a society for everybody's parents. This isn't a political point. This is a point I would put to governments of all colours, all political parties. Over decades, we have allowed the social care system in England to be degraded. And it has become, in the end, well, you get what you pay for, don't you? And what have we got? A malnourished minimum wage system that is dishing out care in these 15-minute slots by young people, often on 0 hours contracts, who don't even get paid for the travel time between the 15-minute visits. That is not going to provide the quality of care in people's homes that we're going to need if we're going to relieve pressure on our hospitals and if we're going to spend public money to best effect. But on a human level, how can somebody who doesn't have the basic security of knowing what they're going to earn from 1 week to the next, how can they possibly pass on a sense of security to the vulnerable people that they work for? How are we going to build a 21st century care system when the message we're sending out to people who choose to work in this system that looking after somebody else's parents is basically the lowest of the low, the lowest calling that you can answer in society? I just don't believe we can achieve anything like the level of care we want when that is the current approach to care. As I say, not the current fault of this current government exclusively, but certainly made worse by their approach to local government funding. So what do we do about it? And that then brings me on to where we go. Before I you obviously will have a sense of where I'm going in terms of my policy solution. But before I talk to you about it, I just want to kind of say some of the things that I've been wrestling with over the last year, and indeed Sir John Oldham has, and the commission we established on whole person care, which reported this week. I knew it would have been irresponsible in the extreme if I were to come forward now and say, and you know, what we need is another reorganisation to deliver a new policy. Now, you are sick to the back teeth, I am absolutely certain, of people like me coming along with the assumption that a new policy requires new organisations. Of course it doesn't. And yet, that has happened in the NHS over many years. So I am aware that I am inheriting a kind of a situation where cynicism is high about people like me, but also the situation is urgent. And that is quite a complicated policy context in which to work. And I know that the NHS simply doesn't have the wherewithal, the capacity. You know, I think its capacity is pretty degraded, actually, after what has been, in my view, an unnecessary round of reorganisation. I think it's in a weak and fairly confused position at the moment, as people are still struggling to make sense of the new landscape that's being created. I know that if I were to come forward with another reorganisation, that would, as I say, be irresponsible in the extreme. I've also got to look at the reality in local government, because that, of course, the NHS can't just say, oh, that's councils, that's nothing to do with us. It is to do with us, because if councils aren't providing basic support for people, that problem ends up on the door of the acute hospital, and then that acute hospital can't function because those older people can't go home again. The NHS is showing signs, in my view, of beginning to jam up. A&E is the barometer of the whole health and care system. And if you look at what that barometer is telling us, it's telling us that there are severe storms just ahead or here now, because the pressure is simply not relenting. And that is telling us that there's problems building across this whole health and care system. So I've had to kind of work, I've had to kind of be conscious of all of that. And I've also kind of had to look at what happened last time, you know, that minutes after a general election, a new policy dumped on an unsuspecting system. Well, that can't happen again, ever, in my view. You know, we have to ensure that if any change is to be done, it is done collectively, with people buying into it. And that is what I hope I'm about to show you. Well, this is it. This is the report of the Commission on Whole Person Care by Sir John Oldham and his commission. And we are, from an opposition point of view, immensely grateful to him. There are a couple of things to say about it. Firstly, you know, this is the vision. This is what I believe in. This is what I want to do. And it's the product of, as I say, careful reflection about all of the things I've been talking about in the opening section of my remarks today. I've tried to take on board all of those worries that people have about the current ability of the system to accept change. Now, John, has, in my view, has done two very important things for us, and let me just describe what they are. The first is he's given us a route map here to the full integration of health and social care, but without a structural reorganisation. I can work with the organisations I inherit. Simply, we will give them a new job to do. And unlike the last reorganisation, this will have a very clear goal: whole person care. A single service that is able to see all of one person's needs. That's the simplest way I could put it. Or, in another way, to reset the NHS at the start of the 21st century as an NHS for the whole person, able to provide much better care for any people with multiple or ongoing needs. And that's not just frail elderly people. Everyone will always see this debate through that prism because that's the pressure that is most evident on the front line of the NHS. But I am talking here about children with complex needs, adults with disabilities. It is about caring differently for people who need that support. So firstly, we've got a route map here to build the system we want without reorganisation. But the second thing that the Oldham report does is of much more radical significance. If you open your mind to a world where social is brought together with physical and mental, you create the conditions for something truly radical to happen. And what is that? You create the possibility of the true personalisation of care. And that's what this is, a blueprint for the full and true personalisation of care. People have used that word, but in my view, it will never be a reality in a system where one part of it is dealing with people's mental needs, another part is dealing with people's physical needs, and an entirely different bit is responsible for people's social needs. It's only when you take away those barriers, when you have a single service that can see the whole person and all of their needs, that I think you then can rethink fundamentally what good care is in the 21st century, when you can change the default setting for care from the hospital to where it needs to be, the home. That is what becomes possible. Because the social has never been in the NHS settlement, the home has always been, well, that's not where we are, the NHS. We wait when people fail at home, we come in to pick up the pieces after people have failed. Well, that won't work anymore. That can't work anymore, that mentality. We have to have a system that starts in people's homes and in a highly integrated, preventative way, builds a single team of support around those people to provide the care that they want. Not doing to them, but actually give them what they are asking for. Highly personalised, a solution for them, in agreement with them, and also in agreement with their informal and family carers. Those people who are utterly invisible to the system at the moment. Well, that can't carry on, for certain. They have got to be centre stage in this new system, and you have to design solutions for people and families, where they want to be, surrounded by the people they love in their own home. And it's only when you have a single service that can see the whole person, that you can begin to aspire to care that is that personalised. If you're working within the current medical model, you can never get there because you can't see the whole person. It's not funded in that way. And to make this real, we've got to spell out what it means for people. That is where it's got to be, isn't it? Not what it means for structures and organisations. What does it mean for people? And then organisations and structures are going to have to fit in to deliver it. That's the right order of things. So for people, I would want to give the public powerful new rights to pull the system in this direction. So let me give you an illustration of what they may be. It's about saying, rather than a system that overuses targets that in the end have the effect of empowering managers, if we're going to make the shift to a person-centred system, and I use that phrase rather than a patient-centred, a person-centred system, a social model rather than a medical model, then I think we're going to need powerful rights for people to get what they want from the service, from the single service. So let me give you an illustration. That might be the right to a single point of contact for the coordination of all care. Just imagine that simple thing. But imagine what a step forward that is for the person who lives away from mum and dad, working in London in their 50s, 60s, getting worried now about their care when they're away from, when they can't be where they grew up with their mum or dad. Imagine what that would mean for them if they could pick up the phone or email one person who would then correct any problems or sort out any gaps in that support. It would mean the right to have an assessment of your carer's needs. Again, if that was done up front, what a huge change that would be. It could be the right to social and mental support in any setting, such as the acute hospital. Again, huge reassurance to the public who fear that if mum or dad goes into hospital, they may go downhill. But then crucially, the right to care in a place of that individual's choosing. So that might mean dialysis, chemo in the home rather than the hospital. Or it might mean giving birth at home. Or fundamentally ending one's life at home. If we were to have a system that was truly person-centred, that is what it should be able to give everybody if that is what they wanted. And while the last government was right to talk about the importance of choice, I think we have to recognise, those of us who were involved in the last government, that we often ended up giving people choices that they weren't asking for. They didn't often have a strong view about which organisation they would go to for a hip operation, but they had incredibly strong views about where and how their care should be delivered. So this is a vision based on the true personalisation of care. And it's a pretty simple but quite radical thought for parts of our civil service, that if you actually give the public up front what they are asking for, it may actually cost much less in the long run. And that is a simple but, quite honestly, very alien notion to the current way we provide things. These silos are set at national level. And I know that from somebody who tried to reform social care in the last government. We create these divides at the very top between the physical, the mental, the social. And that then cascades all the way down to the ground. And it builds a system that can't see the whole person and therefore can't personalise the care it offers. Now that has to change. The luxury of silo-based working is something we can't afford anymore.
I'm sure there's been a load of questions about
Fine.
that.
I'll just finish on this point then, Nick. I appreciate that you want to get into questions. So let me just finish on this last point. What this means, of course, though, is the system growing into I want the system to have space to grow into a different organisation that can deliver this. It crucially depends on the integration of commissioning, number one, and then the integration of provision, number two. So, yes, a single budget for all care, a year of care budget for individuals with complex needs. I think the best place for that is under the Health and Wellbeing Board. Secondly, the integration of provision. And I think all barriers need to be removed from that. And this is a change. I don't believe the market gets you there. I don't believe the market is the answer to 21st century care. The market, in the end, delivers increasing cost, increasing complexity, increasing fragmentation. I want the existing system to have the space to grow into integrated care organisations. The DGH, operating from home to hospital, providing the full spectrum of care, physical, mental and social. And if that makes me sentimental about the NHS, then to be honest, I don't mind admitting it. Because I believe an NHS that is based on the notion of people before profits is actually an ideal worth fighting for. That is what people trust. But I'm not so sentimental to think that that system won't survive if it doesn't fundamentally change how it thinks and works. If we're to protect that ideal, that is essential. or it will not be able to meet modern standards. I believe I have a plan to make that happen, and I look forward to any of your questions about it. Thank you for listening.